Hello and welcome to week 5. This week we're going to discuss reimbursement. The money, honey, because medical coding professionals are actually responsible for the revenue stream into the hospital. And what I mean by that is, as long as we do our job correctly, the revenue stream, the money coming into the facility, will be what was earned, optimal reimbursement. However, if we do not do our job correctly, then the correct amount of money will not be received by the facility. And what does that mean? That means there will not be the proper amount of money for new equipment, to hire new people, for your paycheck, for your raise. Yes, we're all in this together, and it takes money to be able to provide healthcare services. So we want to make sure that we understand the processes of how we get reimbursed. Okay, so let's start with the participants in this healthcare service delivery, okay? And maybe you have heard the term third-party payer. That's exactly what we want to know, is who is this third-party payer? What does it mean? So I thought I'd explain it to you, okay? All right, so the first participant in healthcare services is the physician or other healthcare provider, okay? The second participant is the patient, the person to whom the provider is providing healthcare services. So we got to have both of these people involved in order to have a healthcare encounter, okay? All right. Now, the third-party payer is a third party. It may be a company, it may be a government agency, it may be a person who is not one of the first two parties who is actually going to be paying the bill, okay? So first party, the provider, second party, the patient, and who's going to pay for this? Someone else. That's your third party payer. Anyone paying the bill for the services provided. It can be an insurance company like Aetna, Prudential, United, Humana, okay? It might be a government agency, Medicare, Medicaid, TriCare. Some people refer to them as insurance, but it's not actually insurance. That's why we use the umbrella term third-party payer. Or it could be another person, a parent or a spouse, whoever. Not the physician, not the patient. Someone else is paying the bill, therefore they are the third-party payer. Get it? Okay. Now let's talk about the different types of insurance policies. Now, the first thing I want to make sure that you understand is that these are types of policies. These are not companies per se. What that means is a health maintenance organization or an HMO. I hear a lot of people referring to them as a company, as an enterprise, okay? When in fact, this is just a description of a type of health insurance policy. As, for example, United Healthcare. They offer a policy that is structured as an HMO. They offer policies that are structured as a PPO. We're going to go over all of these, okay? So it's not a company, it's a method of reimbursement. And remember, that's what the insurance company does. They don't provide the health care. They don't receive the health care. They only pay for the health care. Okay? So let's start out with an HMO, a health maintenance organization, which is a policy. I know the word organization is there. I didn't put it there. So that's why it gets a little confusing, but it's really a policy. Okay? This type of health insurance policy uses a very linear approach to paying for services. So when the patient signs up, they have to choose a primary care physician, also known as a PCP. Okay? That primary care physician is responsible for directing all of this patient's care needs. And I say directing because some healthcare services will be provided by this physician, while others may be referred to a specialist. Okay? So the primary care physician directs all of the treatment that this patient needs, and that is also known as a gatekeeper. So in other words, they stand in front of an individual's health and say, I decide who goes in, who goes to the left, who goes to the right. All right? Now, this has good benefits because when a patient is focused on one primary care physician, that's the person you see, whether it's once a year, twice a year, or 30 times a year, depending upon the patient's health, you get to build a relationship with this person. You get to know them, they get to know you. And that is really important because there is nothing more personal than a patient's relationship with their primary care physician. Okay? Now, I said that HMOs use a kind of linear because they have their network in any particular geographic area, and most of them, well, the big companies like United, Aetna, Prudential, they're going to have nationwide networks, but mostly a patient only cares about what's in their local area, right? So they get physicians, providers, okay, physicians, hospitals, walk-in clinics to join and participate in their network. And part of that participation is it's a two-way street, and that participation says, we'll send you patients, but you have to agree to our price schedule, okay? So we're going to pay you $25 to deliver a flu shot. I don't care what you regularly charge. You're going to accept $25 for a flu shot because we sent you the patient, and that makes everybody happy, okay? You will also find that the limitations of an HMO come into play most often when a patient wants to go to a specialist that is not in the network. Then the HMO says, hey, our deal is you stay in the network or we don't pay. Okay? You can go to see whoever you want. This is America. You have that freedom. But we also have the freedom to say, as originally identified in the policy, you cannot go to somebody who's not participating. Okay? Now, most of these companies have good websites. Many of these companies have good websites where you can go online and see who is participating and who is not. So you know ahead. And if the patient has an HMO, they certainly should, at the very least, ask the question when they're making an appointment before going all the way to the appointment and finding out that this is not a participating provider. And it's as easy as that. It's as easy as calling the 800 number on the back of the insurance card, okay? But it is a responsibility of the patient. You know why? Because the patient is the one that will have to pay out of pocket if they go to a doctor who's not in network. All right? So you have advantages and disadvantages always in everything. It's the yin and yang of life. Okay, now a PPO, Preferred Provider Organization, again, there's that word, but it's really not a company, it's a type of policy. This type of policy gives the patient more freedom, okay? So the patient can go to an in-network or out-of-network. Now, the insurance company will say, well, that's fine. And so we have two payment schedules, all right? We're going to pay this much if you stay in network, and we're going to pay this much minus whatever, less money if you go to someone who's out of network. And remember, the less the insurance company pays, the more the individual will pay. Okay? So on the top of things, the difference between HMOs and PPOs is that the patient who is covered under a PPO can still go to a doctor who is out of network and still get at least part of the bill paid for. So that's an advantage. Now, another distinction is the HMO that's going to limit the patient to in-network is going to have a lower monthly premium and lower co-pays and co-insurance payments than the PPO, which will cost the patient more per month and more co-pay and more co-insurance. And that's why you guys have to know this when you're handling billing. This is not regarding the coding part, but it's part of our responsibilities is to collect the right amount of copay, to collect the right amount of co-insurance, to understand the reimbursement of the companies with which you are with which your facility is participating versus the facility that does not participate. Okay? We got to know these things. You got to know these things as a medical coding professional, and you have to know these things as a person. There's also something called a POS, or a point of service plan, and this is kind of like the combo, okay? It's got a little bit of the HMO, it's got a little bit of the PPO, and there are not many these types of policies. These types of policies can be a little harder to find than your standard HMO and PPO. But what it means is when you are an individual shopping for insurance, you need to pay attention to these details. When you are on the job, you need to pay attention to these details. Okay. All right. Centers for Medicare and Medicaid Services, often abbreviated as CMS. I know they left out an M, but they didn't invite me to the meeting, so I have no way to correct this. So when you hear CMS, it stands for Centers for Medicare and Medicaid Services, which is an agency under the Department of Health and Human Services, part of the United States federal government. Okay. Now, one thing I have noticed over the years is a lot of people get these two programs, which is what they are programs, confused. So I put this little reminder. Medicare, C-A-R-E, think of it as retired people, R-E, retired people, because Medicare primarily covers those over the age of 65. In addition to being 65 and older, Medicare will cover those who have a permanent disability, such as blindness, and anyone who has been diagnosed with ESRD, which stands for end-stage renal disease. These are people that are on dialysis and very often on the kidney transplant list waiting, okay? All right. Now, Medicaid, think of it as ID as in indigent or low-income individuals, or you could think of it as aid, AID, aid to the poor, okay? So very big difference in these two programs. One is for old people, older people, and one is for low-income individuals. Both of them are separate, but both of them are known as federal programs that are state administered. So what that means is the federal government has laid out specific services that are required to be provided that they will pay for, okay? Beyond that, not so much. However, each individual of our 50 states can add, they cannot subtract. The federal is the minimum, okay? But a state can say, you know what, our people need more of this or also this, and the states can add additional services and treatments that are not mandated by the federal government for their residents, okay? This is why these programs, Medicare and Medicaid, even though they're federal United States programs, they are different from state to state. So if a patient moves from one state to another, they have to reapply in the state that they are moving to because coverage may be different. It's also something that you all need to know about if you have someone come into your doctor's office or your hospital that is covered by Medicare and Medicaid, and they're there on vacation, and they actually live in a different state, because you have to make sure what the terms of the coverage are depending upon what your facility is going to provide, okay? So that's why you may hear it's different in every state, but there is that mandated minimum coverage provided by the federal government that nobody can provide less, okay? All right. TriCare is a government health plan, not insurance. Again, this is through the Veterans Administration, and it is going to cover medical expenses for the dependents of active duty service members. It used to be called CHAMPUS, but so that's why they say CHAMPUS eligible retirees, because somebody may have retired when it was CHAMPUS and now it's TriCare, and their families, as well as dependents of deceased active duty members, okay? So this is all involved with the military, and that is important. They also have an aspect of TriCare, which is called a community care organization or program. And therefore, you may encounter this. You may encounter patients in your facility who are covered under TriCare through the community program. I don't want to get into that right now, but the fact is again, you have to know what the facility has to be participating in the community care program, and you have to know so you can properly, not code, it's not going to affect the codes, but it will affect to whom you send the claim form, which claim form you send. This is all part of our job. Okay. Other types of health insurance that you may encounter. Workers' compensation is its very own insurance program. It is individual to each particular state, and it covers medical care for those who are injured or become ill as a consequence of their employment, okay? Not for you to determine. The patient must apply with the workers' comp, must file the report so that they can prove that it is covered under workers' comp. Again, does not affect your coding. It does affect to whom you send the claim form. Disability compensation is a plan that will reimburse covered individuals a portion of their income that is lost as a result of being unable to work due to illness or injury. Now, this is totally separate. This is not health care. Disability compensation reimburses income you've seen the Aflac duck. Aflac. Okay, well, the Aflac duck is selling or representing disability compensation. You know how they say, we'll give you money for those things not covered by health care. So if you have health insurance, for example, and you, God forbid, break a leg and you can't go to work, okay? The health insurance company is going to pay for the care for your leg. It's going to pay for the doctor's visits, the therapy, the cast, putting on the cast, taking off the cast, the whole schlemiel, okay? However, it will not provide you with your lost income. So how are you going to pay your electric bill? And trust me, if you have a broken leg, you're watching television, aren't you? Yes. Netflix, Amazon Prime, TNT, whatever. Okay. So I just included that because it's not actually health insurance. It's kind of health insurance adjacent. All right. Liability insurance will cover loss or injury to a third party caused by the insured or something belonging to the insured, okay? So, here, you are in your own home and you get up on a ladder to replace a high ceiling light bulb. You fall off and get hurt. It is not your regular health insurance that's going to cover this. I'm sorry, yes it is. It's your regular health insurance that's going to pay for your injuries, okay? However, you were a good person and you offered to change the light bulb in a high ceiling for your next door neighbor. So you bring your ladder over there, you get up on your ladder and you fall off. It is not your personal health insurance that will pay for that. It is going to be the neighbor's homeowner's insurance that gets that claim form. Okay? Similarly, if you were in the mall shopping, because Christmas is coming up, yay! Okay, and Hanukkah is coming up, yay! All right, and Kwanzaa is coming up, yay! Okay, so I like any holiday that gives me presents. Okay, so the point is you're in the mall and you fall down the escalator, I hope not, okay, that claim form will not go to your personal health insurance. It will go to the liability policy for the owner of the shopping mall. That's how you get involved with that. Again, does not affect coding. It affects to whom you're going to send this claim form. And last but not least, the automobile insurance, which if the patient is injured in an automobile accident, and when I say automobile, generally that covers almost any type of transportation, but it all depends, okay? Generally speaking, we're talking about automobile accident liability coverage. However, if you are on public transit, then it becomes the liability policy for the owner of the train or the bus, such as the city. Okay? All right? Okay. Chapter 7 in your review book, CMS, Centers for Medicaid and Medicaid Services, and the Inpatient, and then Chapter 8, Inpatient Payment Services Systems, and then Chapter 8, Outpatient Prospective Payment Systems, for your delight in reading, and more specific details on what you need to understand to pass the certification exam and to be successful in your career. Because remember, your employers are going to expect you to know stuff, okay? Your 2022 Medical Coding Training, CIC, I know this is the old picture. I couldn't get a new picture. I figured you guys are very intelligent and you could understand. We are readying for the 2022 CIC study guide, okay? Take your quiz. Try and not use textbooks, but you can use your coding manuals. Although these quizzes will probably not require any coding per se. But if you need a little boost for your any anatomy, physiology, medical terminology questions, remember, your CPT book and your ICD-10-CM code book are right there with a lot of information for you to reference. And then analyze this. This is really, really, really important and can dramatically make the difference between you passing this certification exam or not. Because if you don't analyze the questions that you got wrong, you can't necessarily learn from it. And that is super duper important, because you want to make sure when you're answering a similar question on the actual certification exam, you are answering it correctly. Excuse me. All right. Additional stuff in the course room, Inpatient PPS, that stands for, I forgot. Maybe you could tell me. Prospective Payment System. PPS, Inpatient and Outpatient. This comes from CMS. Also, pull out your Let's Code It textbook and review Chapter 39, which is all about reimbursement, okay? And if you have any questions, you want to clarify something, the smartest students ask questions because the answers will help you get it right the next time, okay? I'm here to support you. Please remember that.